Hello everyone and welcome again to Awesome Tan channel. Today we're going to talk about a short, simple topic, yet very important and common in your daily practice, which is the prenatal vitamins. As we all know, that the prenatal vitamins, we have a wide range of products sitting on the shelf. You all can recommend confidently, but what is important is you have to look for 5 to 6 ingredients that must be in there. So what I need you to remember is the footage. So the footage here represents the ingredient that you need to look for when you recommend the prenatal vitamins. The F here will stand for the folic acid. The I is for the iodine, the D for vitamin D, the I is for the iron, and last one is the choline, the CH. Now, we all know that folic acid is important for the development of the nervous system for the babies, and in terms of dosing, you should really look for a dose range between 400 microgram to 800 microgram. That's the daily allowance for folic acid dose. Another important fact that we need to mention is the folic acid is the man-made form of the folic acid that the body will change it to folate in order to be really function in development of the nervous system. But the folic acid is the more stable form of the folate. Some sources recommend to use the methylfolate, which is the active form of the folic acid. So it is also a good idea to recommend that as well. So just keep in mind methylfolate. We also have some products in form of methylfolate, not the folic acid. Another fact we need to mention that some pregnant women might need higher doses of folic acid, higher than this upper limit dosage range, and these will fall in a specific group, like specific genotypes associated with high risk of neural tube defect, history of previous pregnancy with neural tube defect, malabsorption disorder, obesity with BMI more than 35 kilogram per square meter, the diabetes, and if the mother has compliance and lifestyle issues, and also patients known to have regularly taken anti-epileptic drugs, taken folate antagonists like methotrexate, sulfonamides, the smoker, and belonging to high-risk ethnic groups like the Sikh or Northern Chinese. These people might need higher dose. So if someone would ask you, or if you find a script for like dose of 5 milligram, that should ring a bell that this patient will fall within those mentioned group. The next question is the iodine. So the iodine should fall in a range like 100 to 150 microgram. It is important for the thyroid function for both the mother and the baby, and low level of iodine in the pregnant woman is known to be associated with preterm labor and miscarriage. The next one, which is very important, is the vitamin D. The vitamin D should fall between 1,000 to 4,000 international units. Also, unfortunately, all the available products with the vitamin D don't have this dose range 1000 to 4000, so that need to be taken either like in multiple dose, or we need extra source of vitamin D in separate tablets. The next one is the iron. The iron should be in a range between 20 to 30, and that wouldn't be a problem because all the available products are good in terms of iron dosage. The last one is the choline. The choline would be available in small doses, less than 150. What we really need to look for is 400 to 450 microgram, and we can recommend to eat a lot of eggs during the pregnancy period because eggs are well known as a source of choline. Now we have the available products here, although we have a wide range of products, but we will narrow them down to those three products, which are the Elevate, Pregnancy Plus, and the Blackmore's Conceive Well. We will go in details about each product and which is best to go to in certain cases. So first of all, we got the Elevate in here. The Elevate has a dose of folic acid of 800 microgram, iodine 220 microgram, and vitamin D 200 international unit. Having said that, the Elevate should be taken like a single daily dose. So in terms of folic acid and the iodine, it's got like enough dose, which is 800 250. But if you notice here that vitamin D would be less than the recommended amount, so we can recommend an extra tablet to be taken for the vitamin D to reach the range of 1000 to 4000 international unit. It is good in terms of compliance, as should be taken once a day. The folic acid is good, got the maximum range of 800, so you can recommend it for anyone might need high dose of folic acid, as we mentioned before. The next one, we got the Pregnancy Plus 1 to 3, folic acid 200 microgram, iodine 135 microgram, vitamin D, which is good, 500 international unit. Interesting here is it got choline in it, which is 75 microgram. The dose, as recommended by the manufacturer, is twice a day. So in total, we've got folic acid will be within range of 400. Still good, but you can compare that the folic acid with Elevate is higher. Iodine will be within a good range. Vitamin D would be excellent, within the range of 1000. So this one can be recommended for anyone in need of higher dose of vitamin D. And as we mentioned, choline will be also within the range of 150. The last one is the Blackmore's Conceive Well, folic acid 500 microgram, iodine 150, vitamin D 400. With the Blackmore's, we will notice that it's available in both tablets and capsules in the same package. So being taken once a day, folic acid 500 microgram would be acceptable. Iodine still good. Vitamin D also acceptable. So the Blackmore's Conceive Well will fall in the middle, but you can go for the Elevate if you need high folic acid. You can go for the Pregnancy Plus, being taken twice a day for anyone in need higher dose of vitamin D. interesting fact here, some studies suggest that taking the multivitamins in less dose and more frequently, like twice a day, would be better in terms of absorption, as some absorption mechanism will be saturated if it's been taken in high dose at once. So the rest of the high dose would be flushed out outside the body, and the body will just take the maximum from the absorption mechanism. So to sum up this video, just remember the FEDH, the folic acid, the iodine, the vitamin D, iron, and the choline. These the essential elements that must be in the multivitamin product that you would recommend. Remember to go to Elevate if you need high dose of folic acid, and it's good in terms of compliance. That's been taken once a day. Anyone would need high dose of vitamin D, go to Pregnancy Plus. Remember to recommend it twice a day to reach the required doses. The last one, the black moss, which fall in between, you can recommend it for as a general. It got a lot of other ingredients, including the selenium, just being taken once a day. Remember that it got the capsule and the tablets in the same package. The capsule, the soft gelatin capsule for the omega-3, and the stuff that would be better to be included in soft gelatin capsule. Thank you, and see you in the next time.